Hello, I'm Sakshi, and today I'll be telling you all how I use ClinicalKey Student during my clinical postings. So, for example, I am posted in the Department of Respiratory Medicine. How will I approach that using ClinicalKey Student? First, I will watch videos on how to examine the respiratory system of a patient who is going to come to the department using videos available on this app. After that, I will be looking at cases that are given. Then I will be making presentations. And then I will be assigning questions to myself, assessing my performance, and then reassigning the difficult questions to myself for the questions where I have gone wrong, and constantly evaluating my performance. So I'll show you all how I go about this. I look for videos. I generally refer to Kumar and Clark's videos. They are very nice, very relevant, and they help me cover every single OSCE step. When I watch these videos right before my posting, I make sure that none of the steps are missed because they not only help me during evaluating a patient, but also during my exams. Let me show you all.
Hello, Omar. My name's Amy. Would it be okay if I examined you?
Yes.
Make a general inspection of the patient's demeanour, body mass, any chest deformity or scars, and whether they're confused or distressed. Look for equipment such as inhalers or oxygen support.
You can
Be audible. Over an effusion or area of collapse, they'll be
They
muffled.
also describe the various clinical causes under which you will not be able to see a normal general examination of a patient. And I think that really helps when you visit the wards. After looking at videos, I go through cases. The cases discussed in these videos, again, are very relevant.
So this patient has severe chronic obstructive pulmonary disease, and he's had it for many years, very likely because he has.
These cases not only help me when I am going to the wards to discuss the case with my peers or with the professors, but also when I am solving MCQs, if I'm giving quizzes, it will help me when I'm giving an entrance exam, which is case-based. And there are an entire set of videos that I'm planning to complete watching. I have finished half of them, and I will be finishing most of them by the end of my posting. So these are the videos. Every single case you will be able to see in the ward at least once, and these videos prepare you for that. After that, I make sure that I make presentations. So I'm already in the middle of something with respiratory system. I have these different kind of mucopurulent discharges that I'll be describing during my class. What I can do is I can add images using ClinicalKey Student. Here's how it goes. If I want to add an image based on COPD, I will type that in the search section and I will get images. I can have X-ray pictures, I can have graphs. So I'll be adding an X-ray picture to my presentation. Then I'll be adding a flow volume loop. When I go to presentations, you can see that they've already added it as a slide. Now I can download this as a PPT. As you can see, my presentation, a majority of it is already ready. All I have to do is add headings, and I can start describing this directly in my class. This is how it goes. It is really, really helpful and very time-saving. Apart from this, I also assign questions to myself. I can create a test. on the respiratory system. As you can see, I can choose the kind of questions that I want. It's the questions that I haven't yet seen, the questions where I have gone wrong before. I can choose which mode I want, study mode, exam mode. I generally go for study mode because it helps me, because it gives me feedback at the end of the test and I can retake those tests multiple times to make sure I have increased accuracy. As you can see, these are my questions. And they also give you lab values, which help me revise. And I can keep assessing my performance and making sure I improve with every subsequent test. They give you my lowest scoring topics, my least confident topics, every topic that I've taken so far, discipline-wise, organ system-wise, you name it, and they've given it. So this is how I use ClinicalKey Student most of the times. A lot of my friends also use the PDFs and the books that are available on this. But my approach to ClinicalKey Student is usually for my postings. I watch the videos, I watch the respiratory system, which is currently ongoing. I watch every single system before my clinical postings. I see every single case. I assign questions to myself and I make presentations using ClinicalKey Student. And it has so far been a very useful app. Thank you.